from your record only, clinical problem solving exercises. So if when I'm taking, if it is taken already means please tell me. But from the list that you have given me, it is not there. That is why I'm taking. This is taken or not? Shifa, you can find out from your record. That is a clinical problem solving exercise. Clinical, are you hearing?
Yes, ma'am.
Yes, ma'am.
Is this taken? I think it is not taken. I think this is the first one. Clinical problem solving exercise. What? Page number. I don't have a record. See, I don't have a record with me. I am just telling like.
Ma'am, one question was taken. Question number 4. Rest on.
Oh, okay. Then this is the first.
Only one question.
Okay, then that means from your list I have taken that Naula and Parveen have collected the list. No, from that only I am just following that list. So this is taken as per that list. Okay, so we will see the first problem. 25-year-old female patient came with complaints of itching all over the body. Physical examination shows lesions over the skin and in the fingers. Family members also had the same problem. So, and this is the picture. Just so what is the problem? What is it, Joseph? What is this problem? What is your diagnosis?
Anaphylaxis.
Is there any history of any drugs or injections or anything? There is no history, no? A female patient coming with complaints of itching. And there will be lesions. You can see the lesions all like this on the skin, all over the body. Family members also had this problem. So what can be the diagnosis?
Infection by
Scabies.
Scabies.
Yes. It is scabies only, Joseph. It is scabies. And do you know what is the appropriate drug?
don't know, madam.
Don't know. So it is actually permethrin. And how will you give instructions about application of the drug? We have to give the permethrin cream just below the neck. You have to apply all over the body, and it has to be kept there for 12 hours. And after 12 hours, if, for example, morning you have to take the patient has to take a bath and apply the cream all over his body and keep it like that for 12 hours. Then evening he can take a hot bath, hot water bath. And all the family members should be treated, and their linen, clothing, everything should be kept in boiled water. Then only the infection will go. It is highly contagious, and so that is it is scabies. Okay, now you can write down the answers. It is here. You in your book you can write down the answers. This is the first question. So what is the diagnosis? It is scabies. What is the appropriate drug? Permethrin 5% cream, or we can also use benzyl benzoate. How will you get everything? I have already told. You can just write it down. There is a spelling mistake. Left 4. F-O-R only, not F-O-U-R. Left for 12 hours. Over? Is it
Yes,
over?
madam.
Yes, ma'am.
Okay. Now we will go to the next one. So this is about, I think this may be the second, I don't remember the number. 55-year-old post-cardiac surgery patient was, so it is a post-cardiac surgery patient. He was on treatment with warfarin 4 milligram per day. Subsequently, he developed pain in the joints, which was diagnosed as osteoarthritis. He was prescribed tablet aspirin 300 milligram twice daily after food. 1 week later, he was brought to casualty with severe hematemesis. So here there is a cardiac surgery patient, and he is on warfarin already. And after some time, he developed osteoarthritis. It's another complaint. For that, he was given aspirin. But after a few days, he was brought with severe hematemesis. Who can answer this? What is the cause of this problem? Helen Matthews.
Yes, ma'am.
Hmm?
I don't know, ma'am.
No, you should not say I don't know, because now you are just going to write the university exam, so you should not say I don't know. You just think and tell me what is the problem. So what is the problem here? At first, first of all, you say what is the problem? Final problem. What is the final problem?
Final problem is osteoarthritis developed.
No. What is the final problem? The patient is brought to the casualty with what?
Hematemesis.
What is hematemesis?
Severe
What is?
vomiting of blood.
Okay. So what is the cause of this problem? In this prescription or in this condition, which can cause bleeding? What are the two drugs she was given?
Aspirin was given
And
warfarin was given.
so what are they? What is warfarin? What is warfarin? Okay, what is aspirin?
Aspirin.
So you belong to which group of quiz competition? Which group?
I think I don't know, ma'am.
I don't know. What are you telling? Next week, quiz competition. You don't know to which group you belong? What is this? These are not just games or something joke. All this carries marks. If you don't know, means you will be getting 0. The project carries 10 marks for your internal assessment. You know that?
Yes, ma'am. Yes, ma'am.
So you should be aware. So next week we are
Group 1.
Group 1. You belong to Group 1?
Yes, ma'am.
Yes,
ma'am.
So you have to discuss among. Already I have told you. You have to start studying everything. So this is not a something joke. Don't think that these are all joke. So we are not.
No.
Okay, then tell me what is warfarin. Okay, then no problem. At least you find out the 2 drugs. So we will ask some other person. Sahila. Sahila, are you there?
Yes, ma'am.
Sahila. So what is warfarin? To which group it belongs? Warfarin.
Ma'am, anticoagulant.
Anticoagulant. So, does it relate relation between warfarin and hematemesis? So it is an anticoagulant. So is it related? Any problem? I mean, is it related? This condition and warfarin, is it related?
Toxicity.
Oh, okay. Correct. So warfarin, it is an anticoagulant. Anticoagulant. What is coagulation? It is clotting, isn't it? Sajila. Coagulation means clotting. Am I correct?
Yes, ma'am.
So anticoagulant means clotting, it is blocked. So there will be bleeding, isn't it? So anticoagulants can cause bleeding. Then this aspirin, it is another NSAID. So can anyone tell what is the, it is an NSAID, what is the other action of aspirin?
Antiplatelet action.
Antiplatelet.
Yes, yes, very good. Who were the persons? I could not, just tell me.
Joseph.
Oh, very good. I can't see you. Okay. So, and one more girl also answered. Who was that?
Nila.
Neela. Okay. So, aspirin, it is an antiplatelet, and here there is an anticoagulant. So, both of them, they can cause bleeding. That is the problem. So, how could this have been prevented? So, instead of aspirin, we could have given some other NSAID because this aspirin is the only NSAID that is having the antiplatelet action in low doses. And how will you treat this emergency means? Yes, Sumaya, there is severe hematemesis. So how will you treat this emergency? Sumaya Rashid, please do go fast.
Yes, ma'am.
Yes, tell me. Did you hear the question? Okay, no answer. Then Lakshmi, you have to go a little fast because I have to finish a lot. Lakshmi B. Yes. How will you treat this emergency? There is severe hematemesis.
Blood
Is,
transfusion.
yes. What will you give?
Blood.
Yes, we have to give blood transfusion. But before that, what is the first step? First step we have to give. She is on warfarin and aspirin. So what is the first step? Severe hematemesis. So what is the first step? We have to stop that. No, already the drugs that are
Stop.
on. Yes. Okay. Now, please write it down. We have to finish the CPSE exercises today. That is why I'm going a little faster. Over? Yes or no?
Yes, ma'am.
Okay,
Yes,
now
madam.
we are going to the next one. So this is a 35-year-old woman who is on anticonvulsant therapy with phenytoin. For past 3 years, came for checkup. She complained of unsteady gait and difficulty in walking. The doctor ordered for investigation of blood levels of phenytoin and asked her to come with the laboratory report. So this lady who was on anticonvulsant phenytoin, and now she is having the unsteady gait. So what could be the cause of this problem? Hiba Harris. What is the cause of this problem?
Toxicity.
What?
Increased amount of phenytoin.
Increased amount of, okay, so it caused phenytoin toxicity, isn't it? So how does blood level estimation, drug level help in the management? Okay, that I can tell, because the phenytoin, we know that is therapeutic window, it is very low. So we have to do the therapeutic drug monitoring and we can adjust the dose level. Okay, you can write it down. Do it fast. Finished?
Yes, ma'am.
Yes, madam.
Okay, so we'll go to the next. So this is a 30-year-old man was brought to hospital with country liquor poisoning. His eyesight was deteriorating and respiration was labored. Laboratory analysis showed increased PCO2, H plus, and decreased bicarbonate. So what could be the toxicological agent? So this is a country liquor poisoning. Who can answer that? Remisa PV. Remisa.
Yes, ma'am.
So what is the poisoning here?
Liquor poisoning.
Either.
Liquor.
Liquor. Which liquor?
Methanol.
Huh?
Methanol.
Oh, okay, very good, very good. Okay, name, okay, next person, Shafi. Shafi, name the agent which may retard the formation of metabolite causing visual damage. Who has not muted? Please mute. Is it Shafi's place? Please tell your.
Hello, ma'am.
No, who is talking there behind? Is it in your house? If it is in your house, ask those people to go out. Okay, Shafi. Can you tell?
Hello, what, ma'am?
Name the agent which may retard the formation of metabolite causing visual damage. Or we will see one more thing. Which drug we can give for this treatment? Any idea?
Ethanol.
Ethanol we can give. Then one more drug is there, no? there is another drug called Formipisol. So, the patient, he should be kept in dark room. Okay, we will write down the answers. So what could be the toxicological? Okay, please write down. Ethanol and Formipisol. Over? Not over? Please don't take any screenshot. Better you write down, because if you take screenshot, you will forget everything. And if you write, that means you will be remembering something. Over?
Yes, ma'am.
Yes. Yes. Okay, now we are going to the next question. So what is this? Mr. K, 60-year-old person consults a dentist for severe toothache. The dentist advised extraction of tooth. The patient has a history of angina and is taking clopidogrel and aspirin daily. Yes, Irene Davis.
Hello, ma'am.
So what is the question? That is this question?
What complication may occur during extraction of tooth?
Okay, tell me what complication can occur.
Bleeding, ma'am.
Bleeding, okay. Why there is bleeding? What is the cause of the bleeding?
Because when the tooth is being extracted, the capillaries and
We are talking about pharmacology, not the clinical aspects. This is pharmacology class. So what is the cause of the bleeding? Anyway,
their
will occur from-
antiplatelet.
Yes. What is that?
They're antiplatelet drugs.
Which are antiplatelets? Name the drugs.
Aspirin and clopidogrel.
Yes. So anyway, bleeding will occur from capillaries only. That is correct only. But the reason for the bleeding is when we are extracting tooth, some bleeding will be there, natural. But excessive bleeding can occur with clopidogrel and aspirin. So what precautions are to be taken to avoid complication? I will ask Abu Bakr. Abu Bakr?
Yes, ma'am.
So what precautions to be taken to avoid this complication? So he has to extract teeth. So, and he's already on clopidogrel and aspirin. So what precautions should be taken before going for the extraction?
Stop these drugs.
Very good. So stop aspirin and clopidogrel 1 week before that. Okay, now you can write. Over. Write fast. I think it may be over, isn't it? Over,
Yes,
no?
ma'am.
Okay. Sorry. So now next one. A 7-year-old child was admitted with severe nausea and vomiting and abdominal pain. Physical examination revealed liver tenderness. So this is a child admitted with nausea and vomiting and abdominal pain, and liver tenderness is also there. Laboratory reports show elevated paracetamol level of 50 milligram per ml. So there is a excessive level of paracetamol. So ifuna is not there. Ifuna. I saw your name here. You are not there. Okay, Sama. So Ifuna is absent. Sama.
Yes, ma'am.
Yes, ma'am.
Who is that? 2 yeses. Ifuna also.
Sam.
Yes, ma'am.
No, who is telling this? Sama or Ifuna?
Ma'am, we both are here.
Okay, then I'll ask Ifuna first. So Ifuna, what is the first question? Here, this question.
Given to this patient.
Name the specific antidote to be given to this patient. What is the antidote for paracetamol poisoning?
N-acetylcysteine.
Yes, very good. Okay, so what is the mechanism of action? Okay, we will see that. What are the supportive measures to be undertaken? Ifuna, you can tell me what are the supportive measures? Supportive measures. So this is a paracetamol poisoning, isn't it? So in a poisoning, what is the thing you will be doing?
Gastric lavage.
Yes, very good, very good. So then, okay, then now Sama can answer why paracetamol poisoning is severe in children than in adults. Okay, to say this answer, we had to come and first say the mechanism of action. Yeah, can anyone tell what is the mechanism of action of this paracetamol poisoning? Can anyone? Please come forward. What is the mechanism of action? Or what is the metabolite that is formed after the metabolism of paracetamol? What is the name of the metabolite? So next week you are going to appear for the quiz competition. You should be knowing everything. Okay, paracetamol, what is the metabolite?
N-acetyl.
NABQI.
N-acetyl parabenzoquinone imine. Okay, that is NABQ. That is the paracetamol metabolite. Okay, I will explain what is the mechanism. Because usually in normal case also paracetamol will be converted to the this minor metabolite NABQ. But NABQ is usually it will be detoxified by glutathione. But if you are taking lot of paracetamol tablets per day, then this glutathione may be not sufficient for detoxifying the minor metabolite. So this minor metabolite, it may attach to the liver and kidney, etc. It can cause hepatic necrosis, renal tubular necrosis, etc. So that is the problem for paracetamol poisoning. So for this, we have to give the antidote, N-acetylcysteine, and we have to give the supporting measures like gastric lavage. And if needed, we have to do the dialysis also. And why paracetamol poisoning is severe in children? Because that glucuronation, that is detoxification, that is it is less in case of compared to adults. It is not developed in case of children. That is why paracetamol poisoning is severe in children. So even if you think that paracetamol is a safe drug, but we have to be very careful. It should not go beyond 5 to 10 grams. In children, if it is 5 grams, means it is dangerous. For us, it is 10 grams. So one paracetamol, usually it is 500 grams or 650. So $650 you will say, or 500 milligram. 500 milligram usually we may take around 5 into 4, 2 grams. That is usually we will go for 2 grams. But if it comes up to 10 grams, that may lead to toxicity. So we have to be very careful. Okay, now you write down the answers, and the mechanism of action I have not written. You can copy it from your textbook and you can write. So write down this. Yes, this is the picture of the gastric lavage.